High blood pressure, also called hypertension, is a serious medical condition that affects human health. Hypertension and its complications are chronic diseases of the highest mortality. Most of the hypertension and complications can be effectively prevented and controlled if detected earlier. So it's quite important to have a blood pressure monitor with high accuracy. Then there comes the question, how much do you know about the blood pressure monitor? The medical standard of the non-invasive blood pressure measurement is the mercury sphygmomanometer. It was invented by a Russian, Dr. Korotkov, in 1905. In order to commemorate him, the mercury sphygmomanometer was also named Korotkov sound blood pressure monitor over the upper arm, using a mercury pressure gauge, inflatable cuff, the plates to block the blood flow, then to deflate gradually. When the cuff pressure is less than the systolic and greater than the diastolic, there is blood pulse flow. Each time, when the artery changes from the cuff, whenever there is blood pulse flow, the arterial blood vessel is no longer opening and closing. The Korotkov sound when the last Korotkov sound heard. The Korotkov sound blood pressure monitor creates a time of non-invasive blood pressure measurement. But it cannot avoid the situations of sounds and blood flow are out of sync. Like there's blood flow but no Korotkov sound. There's Korotkov sound but no blood flow. The sound is too weak to be heard, etc. And because of the complex operation and high requirements for the operator's hearing, visual reaction, gas release rate, the measurement precision is unable to be further improved. In more than 100 years from the Korotkov sound blood pressure monitor until now, people have been exploring the more accurate and convenient blood pressure measurement, but weren't successful, including the oscilloscope electronic sphygmomanometer. The hospitals have to continue to use the old Korotkov sound blood pressure monitor. Until 2012, the pulsewave blood pressure measurement, which was more accurate than Korotkov sound method was invented, marks the beginning of the precision non-invasive blood pressure measuring time. Now, the pulsewave blood pressure measurement has obtained innovation patents of China, South Korea, Japan, Russia, South Africa, and also applied patents in more than 40 countries. The cuff of the pulsewave blood pressure monitor has two bladders and two tubes. The upper bladder is the pressure bladder to block the blood flow. The lower bladder is the pulsewave detector. Inflates to block the brachial artery blood flow. Then to deflate gradually, the brachial artery blood flow the blocking state. The upper bladder detects the pressure signal and the lower bladder detects the pulse wave signal. The pulsewave blood pressure monitor gets the accurate systolic blood pressure values by calculation according to the multi-point upper pressure signals and lower pulse wave signals. It avoids the error caused by the sound and blood flow are out of sync, such as pseudo-hypertension, which is easily caused by the Korotkov sound. When the cuff pressure is less than the systolic and greater than the diastolic, the artery from closed to open state, there is blood pulse flow. Is the cutoff pressure when the lag time achieves the stable state. The pulsewave blood pressure monitor gets the accurate diastolic by calculation according to the multiple lag